spine. Yes, spine. And this is the fossa, infraspinous and why supra-infra? Because it's above the spine. Yes, fossa means basin-like structure. Yes, you see there is a basin-like structure. Easy, eh? Yes. Okay. So now it comes the tibia fibula. Yes. So what structures we have in tibia fibula? You see malleolus. Malleolus in okay. Lateral malleolus and lateral and now you understand what the importance of medial lateral? Yes. Okay, you see there is a tuberosity. Tuberosity means round structure. Okay, you see lateral condyle and medial condyle. Condyle also round structure. Yes. Now this is a real bone picture. Yes, you see there is a trochanter, there is a head of femur. Yes. Now what are these? Are the articular cartilage. You see cartilage. Yes. This is which joint? Which joint? Knee joint. Yes. So in knee joint you see there is a tibia. This is which bone? Tibia. This is which bone? Femur. Which end of femur? Distal end. Yes. Distal end of femur. Now epicondyle, lateral and the medial epicondyle. Yes. Now we will study the openings. What are the type of openings we have? Okay, you just read this slide. You see everything I have mentioned and I have discussed. Like we have an external auditory canal. Yes. In ears we have external auditory canals. So meatus and canals are same. Yes. So inside the skull we have internal auditory canal or internal acoustic meatus. Okay. Groove already explained to you. Fissure is a slit-like opening. Slit-like. You see there is a inferior orbital fissure in the orbit. You see in this? Yes. Inside this there is a fissure, slit-like structure. Yes. Now notch. What is notch? Anyone? Notch. Edge. Yes. Edge. Edge means what? You see greater sciatic notch.
Yes.
Next picture. See greater sciatic notch. Edge-like structure. Now we have fossa. Yes, iliac fossa. Why? Because ilium bone is there. There is a basin-like structure, so it's a iliac fossa. Iliac crest, thick border. Yes, everything is okay. Foramen. Foramen also opening. Yes, window-like structure. Foramen is what? Opening. Obturator foramen. So always we use. Now you see we have a optic canal. Canal is meatus. I told you, canal like passageway, subway, like passageway, canal. Now this is a fissure. Now you see here. What is sinus? What is sinus? Anyone? Okay. So we have a air-filled cavity inside our bones. This is called a sinus. Yes. In frontal bone we have a frontal sinus. In maxillary bone we have a maxillary sinus. So you have listened to term sinusitis. Yes, some patients have headache. Why they have headache? Because there fluid inside the sinus, accumulation of fluid inside the sinus. So we have a headache in this sinusitis patient. Sinus is cavity within a bone. You see there is a sinus. Yes, you see there is a sinus. Inside a bone there is a cavity filled by air. Yes. Now, okay. So here you see we have a how many foramens? Jugular foramen. Foramen oval. Yes. Internal meatus. We have a external acoustic meatus, external auditory canal. This is internal. And what is this bone? Orange bone. What is this bone? So temporal bone is nothing but the ear. Our ear is located in the temporal bone. Okay. From this bone there is a internal acoustic meatus. This goes to the brain from the inside. Okay. So you should know all the structures passing through this foramen. They will ask questions to you. What structure passing through the jugular foramen? What is passing through the internal obstetric meatus? Yes. What structure for this? For this, what structure is going on? Spinal cord. Spinal cord is going. This foramen. So you write the homework that you should know all the structures passing from the foramen from skull. Foramen from skull. All the structures passing through the foramen from skull. According to origin, yes. What is origin and what is insertion? What is origin? What is insertion? Anyone? Muscle cannot push, they only can pull. Yes. Muscle cannot push, muscle only can pull. What it means? It means whatever the actions muscles are doing, they are only pulling the structure, they are pulling the bones. Yes, this is the function of muscle. This is the movement done by muscles. We have a puppet show, Katputi dance hota hai na? Yes, sir. We have a thread and we are pulling the dolls, yes, doing dancing of the doll by the thread. The same muscles work, the same functioning of muscle is the same. So, what is this origin? If I am pulling something, yes, if I am pulling something, one hand should be fixed and one hand is moving. Am I right? Suppose I am pulling something, yes. So when I can pull, one hand should be fixed and one is moving. So in the body, during the dissection, we will not understand by seeing the structure what is the origin, what is the insertion. Am I right?
Yes.
Why? Because we cannot understand, we are not knowing the movement, we cannot define the origin and the insertion. So by the movement only we decide, okay, this part of muscle is fixed and that part is moving. It means the origin is this and insertion is moving. You got the point?
Yes.
What is the insertion? समझ में आ गया?
Yes.
So origin is what? The point, the part of muscle that is fixed is origin,
Yes.
and the part of muscle that is moving is insertion. Yes. So some muscles has two origins. So we called it biceps. Yes. We have origins. Biceps has two origins. You see, one, two. So this is biceps. The name is brachii. According to location, location is arm. Arm means brachii. Yes. So according to location, this is brachii, and according to origin, this is biceps. We have a triceps, brachii. Triceps means triceps means and brachii means arm. Yes. So the muscle, what is located, where is located arms, there is brachii. Yes. And biceps or triceps. Secondly, we have a quadriceps femoris. Quadriceps means how many? Four origins. Four attachment, four origins. Yes. And femoris means femur. Muscle names are easy.